Hello there, welcome in. If you are turning age 65 or wondering what your initial enrollment period is for Medicare, you are in the right spot. My name's Elliott Martin. I'm with Martin and Associates Insurance Services. We're an independent insurance broker. We're in Irvine, California, but we've got over 25 state licenses, work all throughout the country. And we're going to jump into what this initial enrollment period is. So thank you for joining. So your initial enrollment period, as far as Medicare concerned, is a window of time that really surrounds your 65th birthday month. So that is the period of time where you're going to become eligible for Medicare and you enter in what is called your initial enrollment period. So here's the definition. The initial enrollment period is the 7-month period when someone is first eligible for Medicare for those eligible due to age, meaning turning age 65. This period begins 3 months before they turn 65. It includes the month they turn 65 and ends 3 months after they turn 65. So this is that 7-month window that surrounds your 65th birthday month. So for example, let's say you were born on October 2nd. Your initial enrollment period would actually start, July, August, and September. Include October, and then you also have November, December, January to apply for your original Medicare benefits. If you were to apply in any of these 3 months prior, July, August, September, you would get an October 1st effective date for your Medicare benefits. If you apply in October, they will start your benefits November 1st. If you apply in November, they start your Medicare benefits, December 1st. So that's how it usually works when you apply for your Medicare benefits. Now, there's one caveat to this. If you were born on the first day of a month, you can scoot this chart basically a month prior. Every month, a month earlier, basically. So if you were born on October 1st, your initial enrollment period starts June, July, and August to get a September 1st effective date. If you apply in September, you get an October effective date. So that is the one rule. If you are born on the first day of a month, it works just a little bit different. You've got to scoot everything else up by a month. So that is when your initial enrollment period begins and ends. Now, it's basically the time when you can apply for your original Medicare benefits, both Part A and Part B. Those are the two main original Medicare benefits. It's also when you might need to make a selection for prescription coverage, which is Part D as in Delta. But we don't want to jump into that quite yet. So Part A is your hospital coverage, which is usually 0 monthly premium for most individuals who have paid their taxes for at least 40 credits or 40 requirements, their FICA taxes, right? So most individuals here in the United States are going to get a premium-free Part A. And then Part B right now, as of the recording of this video, here in 2023, it runs $164.90 a month. In future years, if you're watching this in future years, it could be a little bit more, maybe a little bit less, but most likely a little bit more, right? And that's the minimum. If you are a higher income earner, you could pay even more for Part B. So this is when you would apply for these two parts of Medicare. And this is what your Medicare card would look like after you've applied for your Medicare benefits during your initial enrollment period. You are going to get issued out a red, white, and blue Medicare ID card. I am not affiliated with Medicare. This is just a sample of what the Medicare ID card looks like. How you would apply for Social Security. Also, I'm not affiliated with the Social Security Administration. They are a federal agency, a federal department under HHS or CMS. CMS is under HHS. I'm not sure exactly how that, the hierarchy of these agencies. But anyway, back to applying for Medicare. If you need to apply for either Part A or both Part A and Part B at age 65, then you will want to contact the Social Security Administration. Now, there's a couple different ways you can contact them during your initial enrollment period. The first way is to go online. That's probably the easiest way, ssa.gov/Medicare. That is the website. You'll have to create an account, and then you can go ahead and start up your Medicare application around your initial enrollment period. You can also call the Social Security Administration. Here is their nationwide number, 800-772-1213. Wait times can be an hour, over an hour. before you get somebody on the line. So if you do have your AirPods, your headphones to connected Bluetooth to your cell phone, might be a good idea to have those in. That way you can walk around the house or put it on speakerphone and take care of things around the house while you're waiting to talk to somebody at Social Security. The last option to apply for Medicare is to walk into a local Social Security office. You'd probably want to go first thing in the morning, right when they open, to try and get there in to see somebody as soon as possible. So that's how you would apply for Medicare A and B during your initial enrollment period. Now, one of the inevitable questions is, hey, Elliott, I'm going to continue to work past age 65. What do I need to do? Well, there's really two questions that Medicare cares about. One, does your employer have 20 or more employees? And the second question is, does your current prescription coverage on your employer group plan, is it considered credible prescription coverage? If you can say yes to both of these questions, and let me move my darn video out of the way so you can read my text on the screen. If you can answer yes to both, you can enroll into Part A, which is 0 monthly premium, and you should be able to delay Part B until you retire penalty-free. Once you become retired or switch from an active employee to a retiree, you definitely need to activate your Part B and have that go into effect. Okay, so that's normally what we would suggest for most individuals who plan on continuing to work past age 65. The only part you maybe want to apply for during your initial enrollment period is your Part A benefits only. Delay Part B until retirement. No need to be paying your Part B if you've got coverage, primary coverage through your employer. Okay, there is one caveat to this, and I've got another, there we go. I knew I had one more button on this screen. There is a however, and the however is if you have an HSA, a health savings account. So if you are one of the few out there, they're not very common, but I do run into them from time to time. If you do have a high deductible plan that has an HSA contribution, a health savings account contribution, there are some extra considerations to take into account. Here is what the IRS says on publication 969, is to be an eligible individual and qualify for an HSA contribution, you must meet the following requirements, yada, yada, yada. You aren't enrolled in Medicare. So you cannot even be enrolled into Part A if you do have an HSA through your employer and you want to continue contributions. You do not want to apply for any parts of Medicare, and you don't need to, and you won't accrue any penalties as long as you can answer yes to those two questions on the slide prior to this one. Okay, so this is a very important thing. The HSAs are a little bit more complex. It adds to the confusion and the complexity of the question about Medicare, what you need to do around your initial enrollment period. Okay, so if you have an HSA and plan to continue contributions, do not apply for any parts of Medicare at age 65, not even Part A, as long as we can answer yes to those two questions, okay? 20 or more employees and you have credible coverage. Okay, otherwise you may start to accrue penalties. Okay, so I want to make that clear that you need to be able to answer yes to both of those questions, and even in future years. So if your company's on the borderline, 21 employees or 20 employees, and they may drop down to 19, that can get a little tricky. Okay, so just be careful in those situations. We don't want to get you into any trouble. Okay. Another thing, you want to try and stop contributions to your HSA 6 months prior to applying for Medicare. The reason for that is Medicare will usually backdate your Part A by 6 months. Okay, so if you're going to retire at 67 and you apply for Medicare at age 67, they will backdate your Part A by 6 months. So you want to try and stop those contributions in advance if you can. Another thing is, let's say you're going to work till age 70. But you're going to collect Social Security at 67. At 67, when you collect Social Security, you will automatically get enrolled into Part A of Medicare. And once you're enrolled into Part A, you are no longer HSA eligible, according to the IRS. Okay, I'm not a tax expert, so definitely you want to speak with your tax professional to get their opinion on this. Try and do this well in advance of your 65th birthday, so that way you have a good game plan going into things. So that is some of the extra considerations if you have an HSA. Now, if you want to learn more about Medicare, we put on weekly Medicare 101 webinars. You can visit our website, webinar.martinmedicare.com. I'm going to put a link down in the description below, and you can join one of our weekly Medicare 101 webinars there. So feel free to join. Thank you, everybody, for watching. Hope you learned a lot about your initial enrollment period, and good luck to you with your Medicare, and feel free to reach out anytime to us if you have any questions or need help. But definitely check out our webinars. Take care. Bye-bye.